We are going to study the definition and etiology of the chronic hypertension. Basically, we have taken this part of the video from evidence-based textbook of the MRCOG basically. Okay, so let us define the chronic hypertension. Okay, as all of the doctors know that the chronic hypertension is defined as the presence of hypertension before 20 weeks of gestation in the absence of identiform mole, or persistent hypertension beyond 6 weeks postpartum. Okay, this is very important definition, because if the patient presents with hypertension before 20 weeks of gestation, we can label it as chronic hypertension only if we rule out the identiform mole. Okay, if there is no identiform mole, any evidence of identiform mole is ruled out, then we can say that this is chronic hypertension. Secondly, if a patient is in postpartum period and the blood pressure persist even after 6 weeks postpartum, then that is the chronic hypertension. Okay, now NICE guideline also include threshold value of 140, more than 140 millimeter of mercury systolic or 90 millimeter of mercury diastolic pressure. However, there is a linear relationship between the blood pressure at the first antenatal visit and frequency of adverse obstetric events. Okay, the NICE guideline has included in the definition of the chronic hypertension as the few levels of the blood pressure, like more than 140 millimeter of mercury systolic blood pressure. If we have more than of the 90 millimeter of mercury diastolic pressure, then that is included in the definition of the chronic hypertension. Now, coming to the etiology of the chronic hypertension, we have to understand what is the main etiology, what are the main causes of the chronic hypertension. Okay, so the cause of the primary hypertension is considered to be multifactorial with both genetic and environmental contributions. Okay, and secondary hypertension is identified only in less than 5% of the general population, but has been shown to be present in about 14% of the women of the childbearing age. Okay, so we have to remember this thing. Now, what is the main cause of the chronic hypertension? Basically, it is said that renal disease is the most common cause of secondary hypertension in pregnancy, and chronic kidney disease affects about 3% of the women of the age 30 to 39 years, and pregnancy may be the first time it is identified. Now we have some list of the chronic hypertension. Okay, and if we keep all these causes in our mind, only then we can take the proper history from the patient by ruling out each and every possibility of the chronic hypertension, provided the patient has fulfilled the criteria of the proper definition of the chronic hypertension, as we explained in the first slide. Okay, so what are the causes of the chronic hypertension? Okay, first of all, we have to rule out the autoimmune diseases in a patient. We have to ask about the history of any joint pain or any rashes or anything like that, reflux, nephropathy. Okay, for that we have to ask history related to that, pheochromocytoma, Conn's syndrome, hyper and hypothyroidism, carcinoid syndrome, Cushing syndrome, chronic kidney disease. Okay, so we basically have ARP and ARPH and C4, means there are 3 causes which starts with C, like Conn's syndrome, carcinoid tumor, Cushing syndrome, and chronic kidney disease. Okay, so we have discussed few causes of the chronic hypertension, and also we have explained the definition, and in the next videos we will go in some more details of some facts related to the hypertension. Thank you so much for your patience.